very good afternoon to you and welcome to the program Let's Talk Marriage on Treasure FM 98.5. Happy Sunday to you wherever you're listening from. Nice to be with you again. I hope you went to church, and if you did, um, you received a lot of blessings. Okay, good afternoon and welcome to Let's Talk Marriage. Yeah, I have as my guest today. Today we're doing something different. Yeah, in the spirit of the World Infection Prevention Week, 16th to 22nd October every year is observed by the WHO as World Infection Prevention Week. And in the spirit of that, our discussion today will focus on the World Infection Prevention Week. This is a family program, and infection has to do with father, mother, children, everyone in the home. So today I brought medical lab scientist. He's a man of many parts anyway. He's a medical lab scientist, a public health expert. Akan Efanga of Edge Africa. Mr. Efanga, you're welcome.
Thank you for having me.
All right. Say that again. You're welcome.
Thank you for having me.
All right. My name is Rachel Onah. From now till a quarter to two, we'll be talking World Infection Prevention Week. So we'll dwell so much on infection, the causes, the types, and all that. So, Mr. Fanga, what is infection? People use that a lot. Infection, infection, infection. What actually is infection?
Okay. An infection occurs when microorganisms, also known as pathogens, enter the body and cause harm. So when a person has microorganisms in their system that causes harm, then the person can be said to have an infection.
Hmm. So, how do you know these organisms? Are they visible or invisible?
Microorganisms are invisible. You can't see them with the physical eyes, and we have a whole lot of them. Basically, we are going to look at just three. We have bacterial infection, we have viral infection, that is the viruses, we have viral infection, and we have a fungi infection. And all of these cannot be seen with the physical eyes except with the aid of a microscope.
Okay. Okay, that takes care of types of infection. You've mentioned bacterial, fungal, and viral infection. How do we distinguish between these three types of infection?
Okay, they both have various symptoms. Like when we talk about bacterial infection, the bacterial infection can survive without a host. It can survive in any environment. And basically, when we talk about viral infections, these are infections that cannot do without a host. The typical example of the viral infections are like what we call the HIV. COVID-19 also is a viral infection. We have the HPV, etc. We also have fungal infection. This infection majorly would attack the skin, and they cause that part of the body to decompose or to develop irritations. So these infections react to the human body differently, but basically, in order to identify them, one would have to, undergo a medical test.
All right. We'll be back shortly. The program is still Let's Talk Marriage. Stay with us. All right, the program is still Let's Talk Marriage and Treasure FM 98.5. Today we're dwelling on the World Infection Prevention Week, a WHO program. And the theme is sexual health and hygiene. Every 16th to 22nd October every year is celebrated as World Infection Prevention Week. And today we have with us a medical lab scientist and public health expert, Mr. Akan Efanga of Edge Africa, with us right in the studio. We've been talking infection. He has mentioned, infection. He's told us what infection is. He's told us the types, that there are three types: fungal, and what again? Bacteria,
Yeast
yeast,
infection. But this one, fungi,
fungal,
bacteria,
viral,
viral infection, amongst others.
amongst others. Okay. While we were talking, Chama walked in. Chama, where you're welcome.
Good day, listener out there. I hope you guys are great.
Yeah, they are great. I hope you're great too.
Yeah.
Okay, now, Mr. Fanga, how are infections transmitted?
Okay, let me begin with infections can be transmitted through airborne droplets from an infected person. A typical example is like that of the COVID-19. Always told to maintain social distance and always to cover our mouth when we cough because of the consciousness that it can move from person to person. Then the next um, way through which infection can be transmitted is through feces of infected persons. We see the healthcare providers, especially the nurses, they pass through this, they put themselves at risk because sometimes they need to clean up infected patients and the rest. So they can also transmit these infections through waste of infected person, that's through the feces. Number three is through bodily fluids. Bodily fluids are through the blood. It can also be through fluids like the semen, the lubricants from a woman's vagina, and the rest. So bodily fluids can get a person infected. And outside the bodily fluid, we also have by touching surfaces that are infected. That is one of the advice given by the NCDC to always clean surfaces due to COVID-19. That one can get infected if they come in contact with an infected surface. We also have the last but not the least anyway out of many through our underwears. When we don't take proper care of our underwears, they can also get us infected.
Okay, thank you. So now, you've told us how infections are transmitted, and you told us that health workers are at risk. Is there something they can do to avoid such risk of getting infected? Because in the course of caring for people, you get infected by virtue of your job. Like you go to the field too. So how do you protect yourself from infection?
Okay, there are standard protective measures that are laid out. Um, at many times, we are advised to always ensure that we are properly kitted with medical PPEs. Ensure that you're always protected because you can get infected. So at many times, majorly using the necessarily provided PPEs helps you to be able to protect yourself against any form of infection.
Okay. Now, when we talk about infection, there are factors that promote infection, right?
Yes.
So go ahead and tell us the factors that help infections to thrive in a particular environment.
Okay. The first factor is on healthy use of both the private and public toilet is one of them. We know that some persons that work in a public environment where you share the toilet with other persons, when these toilets are not properly cleaned, you can get infected. Majorly, especially the women. We also hear some women will say they don't sit on the public toilet. Um, because they are conscious of infection. But you don't necessarily need to sit on it. You can still get infected even on standing close to it. We also hear some persons will tell you that they use water to flush the toilet before they use it. Some will tell you that they spread tissue on it. Those are not factors that can make you not end up with those infections. So, unhealthy use of the public toilet, also the private toilet when used at home, you have the toilet not being flushed or washed regularly, it can also promote or put a person at risk of ending up with infection. The next we have is douching. When a lady uses soap to wash her vagina, we should understand, the women should understand that the vagina is self-cleansing. And that's why whatever is in there that is not supposed to be, it finds its way out. So you're not supposed to use soap in washing the vagina. It can alter the flora of the vagina and create an imbalance, therefore predisposing the lady to an infection. So douching is not so healthy. We also
So
have
you're saying that women should not use soap to wash their private parts.
we prefer the advice is preferably you use water.
Hmm.
instead of using soap. So you don't put
So
yourself
what
at it.
will soap do?
Okay, basically, when you use the soap, the vagina has healthy bacteria.
Hmm.
The vagina has healthy bacteria. They are there. They are there to help the vagina maintain its normal flora. So when you use this soap, what you do is you alter the pH of the vagina, and you also cause a reaction. Sometimes it triggers an infection that can cause further escalations for the lady. So preferably, you just use water and wash, and be careful with the soap you use.
Okay.
Then we